Welcome back to our channel. Today, we're diving into the AUGUSTUS trial to find out the best anticoagulation and antiplatelet strategies for patients with atrial fibrillation who experience acute coronary syndrome or undergo percutaneous coronary intervention. Let's break it down. Atrial fibrillation, or AF, is a common heart rhythm disorder that increases the risk of blood clots, leading to strokes. When patients with AF have acute coronary syndrome, or ACS, or undergo percutaneous coronary intervention, or PCI, managing their risk of clotting and bleeding becomes more complex. The AUGUSTUS trial compared two key strategies: Apixaban versus Warfarin for anticoagulation, and aspirin versus placebo, in addition to a P2Y12 inhibitor like clopidogrel. This trial aimed to determine the safest and most effective treatment combinations for these high-risk patients. In this trial, over 4,600 patients with AF who had recent ACS or PCI were randomized into four groups: Apixaban or Warfarin, and aspirin or placebo. The main outcomes measured were bleeding events, death, and hospitalizations, providing a comprehensive look at the risks and benefits of each strategy. Results showed that Apixaban reduced major or clinically relevant non-major bleeding by 4.2% compared to Warfarin. Additionally, Apixaban was associated with a 3.9% reduction in death or hospitalization, primarily due to fewer hospitalizations. This indicates a safer profile for Apixaban over Warfarin. Placebo. However, adding aspirin to the anticoagulation and P2Y12 inhibitor regimen increased major or clinically relevant non-major bleeding by 7.1% compared to placebo, without significantly reducing thrombotic events. This suggests that aspirin may not provide additional benefits and could increase bleeding risks. Overall, Apixaban provided a safer profile with less bleeding compared to Warfarin, and avoiding aspirin reduced bleeding risks without increasing thrombotic events. These findings suggest that in many cases, dual therapy with Apixaban and a P2Y12 inhibitor may be preferable to triple therapy with aspirin. In summary, the AUGUSTUS trial highlights that Apixaban is a safer anticoagulant option than Warfarin for AF patients with ACS or PCI, and that aspirin adds bleeding risks without clear thrombotic benefits. Tailoring therapy based on individual patient risks remains crucial. Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe for more updates on cardiovascular care. See you next time. Stay informed, stay healthy.